So what do you think is going to be the most important research discovery in nephrology in the next 20 years? What's going to make our specialty just change? Is there anything in line?
Well, clearly it's the research that I'm doing that's going to make the biggest difference. But all kidding aside, preventing kidney disease.
Yes. Yeah. I think early detection, getting out there, getting the word out about kidney disease will make a huge difference, not only in the U.S., but worldwide.
Yeah.
It's a global epidemic, and we really can make a difference.
Absolutely.
And figuring out how to treat each patient. So the term personalized medicine gets a lot of buzz these days, and I think it's a little bit overblown, and I think we're not anywhere near as advanced in as some people think we may be in being able to do that. But having said that, we talked about health disparities earlier. I think we need to not only get better, find more ways to slow the progression of kidney disease once it's detected, but also get smarter about, maybe a 40-year-old Caucasian woman in my clinic should not get exactly the same recipe of these known kidney protective interventions as a 35-year-old African-American man. And, we're just in our infancy at understanding what those differences might be. So I think that I think we will figure that out. I think we will really need a lot more research. We'll need good prospective clinical trials to determine new interventions and see if some of the things that we think we know are really true. But I think that's where the money is, because as you've alluded to before, it's a silent epidemic of chronic kidney disease. Could be as many as 16% of the population has chronic kidney disease. Most of them don't know it. Their primary care docs don't know it. So there's a lot of patients out there that are going to need our help and intervention. So we need to figure out who they are, figure out what the interventions are, and figure out a way to apply them consistently. Get them access to care, access to the drugs, all that stuff.
And see, my bias is that nephrologists do that better than anyone. We're used to thinking about science, connecting science to practice, and then connecting practice to systems, because we deal with taking care of patients every day based on the science that we know. We talk about taking care of patients in a system, a dialysis unit, for example, or in a chronic kidney disease clinic. So we already think about systems and connecting the scientific knowledge that we have to the administration that we do. I think my bias is that a nephrologist makes a very good administrator. So when I see them around, that's what I'm pointing at.
So in closing, I think we can all say that we enjoy nephrology. We love the variety.
Sure. Yep.
We love our patients. We love what we can do to help our patients in both preventing and in life-saving therapies. And that going into nephrology is something that we don't regret.
Absolutely.
Not at all.
Not regret. Oh,
Absolutely.
my goodness. One of the better decisions that I made, other than my wife.
Yeah.
This is one of the better decisions that I made in choosing.
I agree completely. Well, thank you all for participating today.
Thanks very much.
Thanks for having us.
Thanks, Sharon.